Good morning, my YouTube family. This is Dr. Lee. Welcome to another one of my videos for Prometric. And this morning we will be doing denture care according to Prometric guidelines. This skill is performed on a live person. The dentures will either be on the patient's bedside table or on their dresser, which is like a 3-drawer dresser right by the bedside. For us at this school, we keep it on the dresser, okay? So with that, we will get started. If you enjoyed the video, please give me a thumbs up and hit that subscribe button below. We really appreciate it. So this is Miss Mary, who's also my fraternal twin, and she's gonna be helping me with this skill. So let me go ahead on, step out, knock on the patient's door. We'll come in and get started with the skill.
Come in.
Good morning, Miss Mary. How are you doing?
Good morning.
How are you doing today?
I'm doing fine. How are you?
I'm doing great. I'm doing great. My name is Dr. Lee, and I'm here today to do denture care for you. Is that okay?
That's fine.
Okay, I'm going to pull the curtain to provide for privacy. And I'm going to gather my supplies. I'll wash my hands and I'll be right back.
Okay.
Okay? So I'm washing my hands. Now for my supplies, I need a towel to put on the table. I need my dentures that will be in a denture cup. Also need a cup of water. Toothbrush, and for us we use the denture toothbrush. Toothette that I'll use later for the patient's mouth. Toothpaste, emesis basin. I need a little towel to put into the sink to line the sink, and I need 2 pairs of gloves. I'll put 1 pair over by the toothette because I'll use that later, and 1 pair right here by the gloves. All right. Okay, now that I have my supplies together, I'm going to start this skill by doing the denture care first. So I'll go ahead on and put my gloves on. Put a little bit of toothpaste on my toothbrush so that I can leave the toothpaste here. I'm going to take my towel and my dentures over to the sink. I'm going to move the curtain back just a little bit to make sure that you can see me at the sink here. I like to take a couple of extra paper towels and put over to the side, because for me the paper towels means whatever's on the paper towel has already been cleaned. I'm going to take my towel and line the sink with, place it down at the bottom of the sink. The purpose of the towel is to pad the sink just in case the dentures slip out of my hand. There's a padding there, okay? Still, while holding the toothbrush in my hand, because I need to maintain a clean placement of the toothbrush, I'm going to turn on the cold water and hot water together. For Prometrics, you have an option with the water. You can either turn on all cold water or cold and hot water together. You cannot use just all hot water. The dentures are plastic, and if you use hot water, it will make the denture stretch, and over time they won't fit into the patient's mouth properly. So very important, either all cold water or hot and cold water, which we call tepid or lukewarm water. Okay, so for demonstration, I'm going to put on cold water and just a little bit of hot water, tepid water. Okay, I'm going to take the lid off of my denture cup and rinse the lid off so that it's clean. Now that I know that my lid is clean, I'm going to put it on the paper towel. In my head, that means that it's clean. I'm going to hold the dentures in one hand while I dump out the old water. And I'm going to rinse this cup off and fill it with clean water. And I'm going to set this on the paper towel. So in my head, everything on the paper towel is clean. Now I'm ready to wash or brush my dentures. And I can start anywhere with brushing the dentures. You need to make sure that you clean all surfaces of the dentures. There's a pointed area on the denture toothbrush. That is for getting in the groove. It is not a requirement of Prometric that you use a denture toothbrush. But if you have one, that's the purpose of that little pointed area. But you can also use the flat end of the toothbrush to clean all surfaces of the dentures. Once you've cleaned all surfaces of the dentures, you want to rinse them off. And now take the clean dentures, put them into the clean water that you've already prepared earlier, and place the lid on top of the cup securely. Okay, I'm going to rinse my denture toothbrush off. And now I can turn the water off, remove my towel, wring out the excess water. My towel will go into the linen container, and I can bring the dentures back to the patient's bedside with the denture toothbrush. At this point, I'm through with the dentures part. I can remove my gloves, place them in the trash, and tell the evaluator I washed my hands. Now that my hands are clean, I'm ready to do the oral part with my patient. I'm going to get a clean towel to put around the patient. Miss Mary, is it okay if I drape you? Okay, great. This is to protect the patient's clothing. This is where my second pair of gloves come in. I'm going to put on a clean pair of gloves. For this part of the skill, I have a cup of water, a toothette, toothpaste, and an emesis basin. So the toothette, I'm just gonna open it up so I get a clean one here. It's like a little sponge on a stick, okay? I like to wet it first so you can pour a little water over it. Okay. Put toothpaste on the toothette. Let's see, Debbie downstairs. Now I'm ready to brush or rub this toothette all over the surfaces of the patient's teeth or gums, okay? And on the end, I will get the person's tongue. So Miss Mary, if you can clench your teeth, okay? I like to start in the front, and I'm gonna get all on the side, other side, okay? Get the gums. Now I'm gonna have her open her mouth so I can get the back surfaces of the teeth. At the top back surfaces. Okay, Miss Mary, can you lick your tongue out? This is a requirement. You have to get the tongue, and you can just do a couple of times. That's it. You don't have to go there and really scrub. Just go through the process. You can close your mouth. Now, I'm going to have the person rinse the mouth out. This curvature area on the emesis basin goes next to the chin, and I'm going to say, Miss Mary, I'm going to give you some water if you can rinse. Whenever you're ready, you can just spit that out. Would you like to rinse again?
No.
Okay. Then I'm going to clean the person's mouth. You can just dab it. After that, I'm ready to start cleaning up everything. My cup, I'm going to pour out the excess water. The cup and the tooth that goes into the trash. The emesis basin, I'm going to dump it, rinse it out, and then dry it. Okay, so I'm going to put the toothbrush, toothpaste, and all of this back over in the patient area. My towels, I'm going to put that into the linen receptacle. I can take my gloves off at this point once I make sure I put everything up. When I remove my gloves, I want to immediately say I wash my hands. Okay? Now that my hands are clean, I can go back to my patient. Miss Mary, I'm through doing denture care. I put your dentures back on your chest. Would you like the light on or off or a magazine?
No.
You're good?
I'm good.
Okay, I want to give you your call light so that you can call me if you need anything. Okay? I'm going to close the curtain because I had it open. I had the curtain closed, so I'm going to open the curtain. All right, so I'm through with Miss Mary. Before I end the skill, I'm going to say I wash my hands, and I'm through with that skill. I hope that you enjoyed this demonstration of denture care according to Prometric Guidelines. And if you did, again, please hit the subscribe button below. Give me a thumbs up. I appreciate it. And I will see you in the next video. Goodbye.